written here. SSRIs have different responses on the sexual functioning, mainly on the plateau phase. You'll read between like 0% on Cerazone or Wellbutrin. Like Wellbutrin or bupropion actually will increase sexual interest by about 10%. That's one of the ones I use to help people. And then you can go to like the Zoloft group, which I've seen as much as 48% people are affected. But that's a statistic. We don't deal with statistics, we deal with patients. So if I have a patient that says, you know, Susie and I spent 12 hours trying to have an orgasm and it didn't work, well, I'm not going to say, well, this one is less likely, I'll just give them another type. And sometimes that's all it takes to fix. There's other tricks, like we call it a drug holiday. So it's Thursday, Sunday, right? So stop Thursday, and by Sunday, a lot of these meds are out of your system. Don't do this without your provider, blah, blah, blah. But the point is, we do these kind of things. We can add products. We can decrease dosing. Sexuality is important to most human relationships. And so we try to do what we can, but you have to ask people. So yeah, there are studies. Generally speaking, SSRIs are 20 to 40% of people will have a side effect like that.
Is the effect on the sensitivity to being stimulated or on prolonging the...
It's a specifically plateau thing. Sensitivity is another issue with premature ejaculator, and I'll bring that up real quick. One of the theories on premature ejaculators is that it's not all a brain thing. Our main focus, we think, premature ejaculators, it's a brain thing. But there are some people who have hypersensitivity. So too much stimulation to genital organs, they're done. Orgasm's done. But there's a way of reducing that sensitivity. There's sprays and gels and condoms, and there's a whole ton of stuff you can do to reduce sensitivity. But if it's a brain thing, that won't change much. I saw a hand somewhere. Sir?
What if we like the plateau phase?
If there is no plateau phase...
No, what if we like...
Oh, the plateau? Then take more Prozac.
The plateau phase is very nice.
Yeah, and actually now there's some literature on splitting in males orgasm and ejaculation.
That's right.
And so there's some really interesting stuff starting to happen. And they're going back to like some of the ancient Indian kind of... It's very interesting stuff. Yeah, tantric sex, and I'm not sure where that's going to go. It sounds pretty involved, and most of the guys I talk to are kind of mainly rooted and they want to have sex and they're done and they're happy. And so it's very interesting. But yeah, I was looking at this literature when I was researching for this book, and I was like, well, that's kind of hard to split them, but I guess it can happen because one's a brain thing and one's a physical thing. So interesting stuff. All right, let's see. So medications. Cardiac meds, very, very common cause sexual dysfunction. Okay? Very common. I've got like 3 pages of medications that can cause sexual dysfunction. It doesn't mean if I give you whatever med, you're going to have a problem. It means there's association. And each drug can cause a different type. Retrograde ejaculation, decrease in firmness of erection, decrease in interest, fatigue, right? We just talked about the sleep study, the sleep talk was right before us. There's a product called Lunesta. Lunesta's got a really nasty little side effect, which means it's secreted by the salivary gland, which gives you a bad taste in your mouth. Who wants to kiss somebody like that? So these little things, we talk about arthritis, right? Fatigue is a major issue. Beta blockers can cause depression. You know, there's a lot of stuff out there. If you got a rash, who wants to have sex? So these are important. Medications, people, as you get older, there's more medications. I mean, I have people coming in with, and Dr. Kadish sees it all the time. You come in with a little satchel. They have like 15 supplements, 9 different medications. So not only does each medication have a side effect, but the interaction could be an issue. So it is complicated, but medications are a big, big difference. Okay, this is our billboard down there in Medford. It's still up, by the way. I stopped paying for it last month. And this is from Burning Man, and this reminds me about systemic hormonal medical issues. So going back to this young lady, incontinence. Okay? A third of women who have incontinence lose urine with intercourse. So they're devastated. They're having sex and they're urinating. Okay? What's interesting is when I talk to these women and they finally admit to me, because a lot of times it takes a fair amount of trust before people will talk, the guys don't even notice it. In fact, they think things are great. And when they do notice it, they don't care much. So sometimes it's an educational thing. So I'll sit both partners, and then, I got a permission, of course, and then I'll say, about a third of women will lose urine with intercourse. And I think that happens here on occasion. He goes, oh, really? I didn't notice. Doesn't bother me. And that's the end of it. Because some people worry about more than it's worth worrying about. Okay? Hormonal issues we talked about is very much more important in males. And there's a whole battery of tests we do. And there's testosterone patches and pills and shots and all sorts of things. There's even pro-testosterone. There's growth hormone issues. There's a ton of different stuff out there. Arthritis is really common as we get older. So some people will find arthritis is better in the morning, so that's when you have sex. Other people, it's the opposite. They're stiff in the morning, and then by the afternoon they can move and do their stuff, so have sex in the afternoon. Some people find that hot water really helps. So have sex in a hot tub, or take your hot bath and then have sex. There's things we can do. There's some issues that maybe sound funny to us, but do you take your leg off before sex? Do you take your teeth out before sex? I mean, these are issues that, take communication and sensitivity. Okay? Some people are into that. Some people, it's pretty devastating. I do surgeries all the time. Every Friday we do a bunch of surgeries. And I will tell you that of all the things we do that are embarrassing to people, to women, taking out a woman's teeth is like by far the worst. I can do a rectal exam, I can check out their cervix, I can whatever, but those teeth are the last thing that they will allow their partner to see out. It's absolutely amazing. They never taught us this. So I see that all the time. So that's something that's important to know. You talk about it. You have to be sensitive to it.